Order number 12, motion, recruitment and remuneration of community health promoters, resumption of debate.
So, honorable members, in this motion, the Honorable George Murugara had a balance of 13 minutes in moving, so you may proceed.
In moving, yes. Thank you very much. Thank you very much, Honorable Speaker. Honorable Speaker, I beg to continue moving that the government, the national government, does formulate and implement a policy framework to guide on the recruitment and remuneration of the community health promoters across the country. Honorable Speaker, I move to Article 43(1) of the Constitution, which provides that we are entitled to the highest attainable standards of health in the country. It is mandatory for the government to provide health care to its citizens. And this is why I laud our government today, because we have come up with what is known as the universal health care under Article 43(1) of the Constitution. Universal simply means every Kenyan is entitled to highest standard of health care in the country, and it does not matter what it takes. The government is under an obligation to provide this. And this is the reason why today, as we speak, we have come up with what is known as the Social Health Insurance Fund. First, it's an insurance cover, whereby we try to register every Kenyan to become a member and also a beneficiary. It's good to point out to the country that since this is an insurance, there must be an element of premiums. And this is why every Kenyan is required to pay certain sums of money into the fund, and then after that, benefit. What is the net effect of this? When you get ill, then this fund is supposed to take care of you. And to an extent, it has done it so well that many people who were initially singing that shift does not work are now turning around to say it does work. Shift is actually executed through the Social Health Authority, which is the entity charged with this responsibility. Now, what role do community health promoters play as far as this is concerned? We must admit that as they go around, and these are very, very important people in our rural setup, especially rural setup, where medical facilities are scarce. What are those medical facilities? We are supposed to have hospitals, health centers, and dispensaries. In most of these rural areas, we don't even have health centers. We only have dispensaries. So these health promoters, as they move around, they are also encouraging members of the public to register to be members of SHIF through SHA. And SHA or SHIF, when it works, it's sending money all the way to the dispensaries in the villages, so that these dispensaries, through their development in infrastructure, they are able to improve themselves, they are able to procure drugs, they are able to procure facilities. This is a function bestowed on these health workers to ensure that the public is educated as regards what the benefits of SHIF and SHA would be. Something else which these health promoters do is to ensure that they deal with basic ailments from the rural population. The basic ailments include common malaria, which is found everywhere. They have also to do with what are called the common health diseases, including blood sugar and the other ones that they have to deal with. All these ones, they are trained to actually test them, give advice, and then recommend you over to the next available health institution, whether it's a dispensary, whether it's a health center, and whether it is a hospital. It is these health workers that do this. So today, as we discuss this extremely important motion, we have to bear in mind that these people who do so much work that is highly valuable, work that ought to be done and must be done, do not get any salaries for the work done. They do not get any proper remuneration. We know for sure what happens is the national government makes a contribution of 2,500, while the county government makes a contribution of another 2,500, and they receive a token of 5,000 shillings for such work. This is the reason why I have considered it necessary to bring this motion, so that we now resolve that our government will actually formulate and implement a policy so that these people can start earning a salary. They will be better trained, and there is no problem with us coming up with educational qualification, simply because educational qualification is based on the education we give to our children. We take them to school to learn, we take them to colleges to learn, and then after that, they can actually take up jobs such as this. But before that is done, those who have been assigned to this duty, who have volunteered in the first instance and are receiving the stipends, should continue receiving the same. And if the government can, as we formulate the policy and implement it, improve on the stipends, then it is highly advisable that this is done and these people receive better remuneration as we go along. So this is a very important motion, and I urge the members of parliament who are here to actually support it so that we can move to the next step, which it includes, if we have to develop a bill which will come to this house to be passed to become an act of parliament, then we do so and take care of these very vital workers in our health sector who must be recognized and must be appreciated. And as I sum up, may I also commend the government, because recently, pursuant to motions brought to this house, and one of them was brought to this house by me on the 28th of February 2019, during my first time, to formulate and implement policies regarding village elders in the country. We thank the government that even if the policy has not been formulated and implemented, at least the village elders today, whatever name they are given, whether village administrators, whether they will be called area administrators, area managers, whichever name they will be getting, today are receiving a stipend from the government. And we commend the government because of implementation of its bottom-up transformation agenda. We have started with area managers. We are now on CHPs, who are also at the bottom of the pyramid of health care in the country. And as we do this, we are uplifting those who are down. They are coming up, and we are realizing what we promised Kenyans during the campaigns, that we will actually be moving bottom up. This is exemplification of the movement of bottom up, moving from down upwards, so that everybody can realize the standards that are required to be achieved as we continue living. Very important for our health sector. I urge the members to support this motion. With those remarks, I do beg to move, and I will request the Honorable Member of Parliament for Buuri, the Honorable Mugambi Redikiri, who had spoken to. He wasn't here when I was starting, and I had spoken to Honorable Mukami, who is going to support the motion, but I request Honorable Redikiri to actually second. Thank you.
Thank you, Madam Speaker. I want to thank you, Honorable Murugara, the Member of Parliament of Tharaka, and with God's blessing, the incoming governor of Tharaka Nithi County, for coming up with this motion. And from the onset, Madam Speaker, it is a motion that requires us to resolve that we improve the premium that is paid to our community health promoters. From the onset, Madam Speaker, we need to congratulate His Excellency the President for finding it good that we have universal health care, and implementation of the universal health care requires that it starts from the bottom. Madam Speaker, when this program was started, many people were doubting the viability, the importance of the health promoters. But as time has progressed, we have seen that they play a very serious role in dissemination of health information. In many areas, particularly in Bole constituency, for example, many people did not have a lot of health education on why there are some illnesses are identified within certain regions. For example, cancer, flu, pneumonia, malaria, high blood pressure, etc. These people, since they started operating, we have seen an improvement of understanding the basic health and even hygiene factors. Madam Speaker, these are very important persons in as far as even the medical research is concerned, because we have seen even in universities, students, people keen to know what kind of health issues are within a certain area, they turn to CHPs. And these people have a lot of information, and they share this information with the researchers, with the students, with the institutions that are keen on trying to look for health solutions. Madam Speaker, the biggest question is, what is the economic implication of the amount of money that we are seeing be increased versus the benefit of having the CHPs? Madam Speaker, it goes without saying, the work these people are doing is bigger than the salary that we are saying is in need to be increased. I'm sure the mover of this motion had in mind, at least if we are able to approach the minimum salary. And, but we need to really say we might not be able to reach the minimum as per the Constitution, but at least an improvement of that premium is going to improve the welfare of these workers. Madam Speaker, these people operate under very strenuous circumstances. These are the people who are caught on the first line. Mama so and so is not feeling well. Baba so and so has a problem. This kid has this. They learn during the cold. They learn during the mud. They learn during the dry season. When it is hot, they are there. And a lot of money that they use, the lot of money they use is theirs. The 2,500 from the county, the 2,500, 5,000 is not even enough to take them for a whole month. So if the benefit outweigh the amount of that amount of money, I think it is very important this House resolves that we improve the premium that are paid. Madam Speaker, really, let's appreciate these people. We have appreciated the law the area managers have done. Let's appreciate these people. They are very important people in as far as our medical sector is involved. I thank you, Madam Speaker.